Namaste TV Asia viewers and welcome to Ayurveda Mantra Show by Santigram Kerala Ayurvedic Wellness Centers in USA. In this weekly show, we talk about benefits of Ayurveda and how it can cure any sickness, disease or illness. Dr. Ambika Nair, one of the directors of Kerala Ayurvedic Wellness Centers in USA, shares her knowledge and experience in this show. Dr. Ambika Nair, welcome to the show. Hope you're doing well.
Hi Sanjeev. Anyway, thanks a lot for inviting me again for this platform.
Correct.
Nowadays, so many people are coming to Ayurveda so that they can lead a good life. Especially it is a preventive too for getting the diseases. That is one of the major things that is accepted by the world now.
Correct. Okay, we're going to talk about that preventive, how it can actually, prevent any sickness or disease in one person's life. We're going to talk about that, but let's just talk about something which is, which caught my attention, and I think it's a very important topic that we should talk about it. Obsessive compulsive disorder, known as OCD.
Yes, OCD.
What exactly is OCD?
OCD is that obsessive compulsive disorder, compulsion,
Right.
an obsession. You have to do certain things, even though you know to do that. First of all, even the person will also know that he is not doing the right things, but still he will not accept it. He will not mind to go for a therapy or anything like that. Normally, it will be, observed by the people from his home. Normally I'll talk about the how you classify it actually.
Correct.
Because the one child is born means when he talks start talking, he will be doing only the same sentence repetition. Whatever or one make him to talk any other word, he will never tell, even though he can speak, because that he enjoys that.
Okay.
You understand?
Now, how do you diagnose this OCD?
Yeah, that's what I'm telling. The parents will tell that.
Correct.
Because how people come to me, doctor, how my child now 3 years only, how are you? You ask the child. The child will be repeating, how are you, how are you, how are you? He will be coming and asking me, how are you? Then you tell your name or his name, he will be repeating, I am Sanjeev, I am Sanjeev, I am Sanjeev, I am Sanjeev. Or the playing with the same, objects, playing with same things, and they don't like to eat anything different, whatever they eat, because they are afraid. Children, because the parents will always come and tell. But once they grow a little more, especially in the college days and in the school days, they don't like to interact with other people. Okay, so they have an inferiority complex like that. Because they are afraid what they do, other people may notice or not. That is one of the main things, how they do it. And not only that, some people are they love cleanliness. Cleanliness in the sense, not even this pen should be here. It should be clean means it should be clean. Okay, nothing should be there. So they come and clean this 10 times. Still they will not get a satisfaction. Again they will clean it.
So they are obsessed with
whatever.
Correct.
See, because it shows that this is all from the vata, you understand? Because you see the mind, their buddhi is not working. See the whatever, even though some days it works, means they don't want to accept it. Okay, and we are going somewhere, some people will go and tell that, okay, wait, to the husband, that ladies also, even some gents also. Other gents also will tell the wife. It's very common. Go and see whether the gas is off, the burner is off,
Correct.
the door is locked. Continuously they tell them, even 3 times, 4 times. Still they will have that doubt in the mind. Okay, and going to somebody's house, you give some glass of water, they will not eat. They think that some infection they can occur it, they can take it. Wherever they go, they carry the things.
So if I understand correctly, this OCD starts at very early, very young age?
Yeah. It is not only in the young age, because actually, you see, that's why we always tell, it can be from the genetics also, it can be acquired also, you understand?
Right.
But acquired, that if you are ignored at the house, then your mind goes in a very destructive manner, you understand? No? So these are like certain types of diseases like that. So it is very, they want cleanliness, they want to do like taking bath. Some people doesn't like to go near the water. They don't like, they will think that they will drown, or they will die over there, or they get suffocated.
Okay.
Yeah, they will not go. It is very difficult to make them understand.
Okay, so parents or elderly realize that this person is a little bit different, and then when they bring it to you, or when they bring it to one of Santigram Wellness Centers, what do you do after that?
Actually, what we do is that, because see, the Nadi Pariksha is one of the important things once we do, that which type of OCD he has, in which way to diagnose the person, from where it came. So we talk to them very nicely. I will always tell that even I was also an OCD. You understand? No?
Just to make them feel better.
To make them into confidence.
Exactly.
Okay, then they tell, okay, then how did you? Some people are very, then some people will, you're just joking. So I tell that it's not joking, because we treat a lot of children like that. And not only children, like I have a lot of cases, so many may be listening now, They may be thinking that I am quoting them. It's not like that, because daily practice I get a lot of people like that. Okay, even doctors, I am telling you, some case comes means they go till the root to find out how it came. You see, like some people, you get a telephone number. You understand? No, they want to see. Means we will ignore. Okay, what it is. Some people are not like that. Who called? Where it called? From where it is? Where is their residence? They go. See, that like a research they go. You understand? Now they get into the roots. Okay, so this is also an OCD, and some people are so much interested in knowing, like the next person's, like all whereabouts, everything. This also, it is, even though it is not needed for them, they go into that. So according to the degree it is, you understand? No? Some people are more, some people they can manage.
Now, do they listen to their elders? Do they listen to parents or anybody?
See, they have to convince them in such a way, like we are not going to the doctor, we are just going to a friend. Then, like she will see you, she is my friend. Because how many children come to me like that? I'm telling, even elders, you understand? So they come and tell that we are going to an auntie. Okay, we just said that. So many times I come out from the consultation room, I just sit outside and talk. Because I know that maybe in the consultation room, they don't feel comfortable.
Okay, good to know. Viewers, we are watching Ayurveda Mantra Show on TV Asia. We're going to take a short break. We'll be right back. Welcome back to the Ayurveda Mantra Show on TV Asia. Today we are talking about obsessive compulsive disorder with Dr. Ambika Nair. Doctor, you mentioned about obsessive compulsive disorder and what exactly it is that we came to know. Many times it starts at very, very early young age, and we were talking about their academic skills and academic capabilities. What we need to know is that how are their intelligence capacity? Are they semi-intelligent, are they very intelligent, or they are not at all?
They are extremely intelligent.
Okay.
Okay. They really want, they really do. They are actually, see, they all are Pitta people, then they become Vata, like they want everything in perfection. So don't think that every perfectionist will have OCD. Okay, so
that's
this
what
is also.
I was going to ask you that later on also.
Okay, so this is also like that, like, but they think that, like, see, another mother brought a child. So they were like from an IAS cadre family. Their grandfather, father, everybody was IAS. But when you come to this country, he cannot be an IAS officer here. Okay, so the mother had like a little obsession, and she sent this child to India. Child grew up in with the grandparents. He came back over here. He did his engineering. He did his masters. He was placed in a very good firm. Very intelligent means very, very extremely intelligent boy.
Okay.
Okay. Then he started going to the, no, I won't be able to do this. That fear came in him. Okay. That fear psychosis. Okay. While traveling, because they used to stay somewhere in New Jersey, and he used to travel to Manhattan. Okay. So he developed a fear. That fear made him not to work at all. He could not concentrate. Boy was 26-year-old. Okay.
And even though, I mean, he was one of the intelligent kids.
Well-placed boy. He was working like 2 years, 2.5 years. Then he was brought to me. Okay. So this fellow, then he asked me, he told all these stories to me. Mother was there. He told, send the mother out. She only made me like this. I told, no, it is nobody made you like this, but there was some issue in the, with the
family.
Family means that they were divorced because something with the mother. So the mother wants the child, whatever she aspire, the child should do. So that is another obsession and compulsion. So naturally, when he could not do everything, you see, you cannot expect everything in one child. He was doing very well. Then he got a fear when he was traveling in the train. So then he could not even come out. So the police only helped him to come out from the train. Then he was admitted. So she knows about Ayurveda. Then she came to me. She's from Delhi. Then she came to me. Okay, we did the treatment. I counseled him. He asked me, when can you ask me like how long it will take to cure? I told, how much you are going to help me? He told, okay, let us see. Okay, let us make a deal. I always joke with them because I know how tense they are and how fearful they are. They really shiver in front of us, like a small 1-year-old child.
Correct.
Very, very sad situation it is.
So to get them to agree for treatment is like a number one step.
Very difficult.
Very difficult, and it's a number one step. Once they agree and once the treatment starts, let's talk about what kind of treatment given by Santigram Kerala Ayurvedic Wellness Center.
See how it comes, not only with the mind, with the body too, like a tan man. Okay, it has to be aligned properly. Okay, that's why it is going like a running like a grasshopper, like a galloping horse. He could not control. So what I did for him is that first of all, I gave him some herbal medication like a brahmi. I started giving him like a snehapanam. We tell them to take it because so he has taken that. Then I gave some medicines for the talam. I told, okay, come after 2 days. He came after 1 day only. He told, I slept. He was not sleeping. Okay, he was not at all sleeping. He told, okay, I am coming tomorrow. Can you arrange some time for me? I told her, don't talk to any of the people in the, clinic, because actually to take him into confidence, I became like his friend. Okay, I told, okay. Then he came. Then we started the Panchakarma treatment. Okay, see, Abhyangam is given to soothe the body, and not only that is a very good treatment for the circulation. Okay. Then we have given him, because he had some other ailments, like that. Then we gave him Nasyam also. That is another Panchakarma. What we do for the detoxification of the upper respiratory. Everything is in the mind, you understand? Because his prana is not moving. It is stable in one place. What he thinks is right. He thinks like that. Whatever he is doing is right. So that was not right. You understand? So I had to deviate his mind. Then we gave him, like Vasti was given to him. Steam bath. Then I started giving him Shirodhara. Shirodhara I started. Then he was improving a lot. He improved a lot. He asked me when I can go for my work. Okay. After like 18 days, he asked me. I told, give me 1 more week. Then we started giving him. I cut his hair short. Then, I told, get your hair short, then come. We gave him Shirovasti. After the Shirovasti, this fellow was on the superlative degree, I should say. Very confident. Still, he takes little medication, like brahmi, like on and off. You understand? No?
And how long this treatment last?
That it was for 21 days. Afterwards, he never came to me. And for the treatment, I never wanted, because he became all right. And there are some other medicines also, like a vacha, so that is speech, because he was unable to, that cognition was very less. See, your buddhi and your manas has to be coordinated. Otherwise, whatever you think also, you won't be able to talk.
Correct.
You understand? So in the office, he could not perform everything, and he really did very well.
Okay.
Yeah.
Well, viewers, this is the Ayurveda Mantra Show on TV Asia. We're going to take a short break. We'll be back very soon. Welcome back to the Ayurveda Mantra Show, viewers. In this episode, we are talking about obsessive compulsive disorder. Obsession and the compulsion. When you have it too much, of course, it's really, really bad. But when you have obsessive compulsion disorder, it's really bad, and that's what we are talking about it in this episode. Dr. Nair, we talked about Ayurveda treatment and then what exactly OCD is all about. If someone goes for other treatment, let's say if they go for allopathy or some kind of other medicine before they come to any one of Santigram Kerala Ayurvedic wellness centers, right? Does that treatment is curable? Does that treatment works as well as Ayurveda, or what is your take on that?
You see, every treatment is good, you understand? Because they become violent also. It's not like just they will be very simple. Some people become very violent because there will be fear and depression also and inferiority complex. So it is very violent, and sometimes 90% people go there, then only they come to me. Okay. So not only to me, to Ayurveda, I mean. Okay. So once they go over there, they give like antidepressants. Okay. So they will be sleeping a lot. And then they decrease accordingly, and I get a lot of clients like that because we are taking all these medicines for a long time, doctor, and it has side effects like that, they will tell me, because then liver issues, acidities, there are so many other side effects which some medicines cause, but I don't say that because tomorrow they will tell that because Ambika is telling like this, that's not right. But they come to me and tell me that how to taper it. So when after doing this, our therapies, we tell them, go back to your doctor, let them taper your medications. Yeah, we get a lot of clients like this.
Achha.
Yeah.
Okay.
Yeah.
All right. Now let's talk about Ayurveda. How can you prevent OCD through Ayurveda?
Yes. Okay. I'll tell you, because actually I have a subject also. See, I want to tell this has to be done in antenatal. You understand? Especially getting married from the same, like a sister, brothers, children. This all not at all advisable, because genetic disorder is also there. And if the father or the mother has any disorders, they should first correct it. Then only they should go for conception. This is more important.
Okay.
More important.
Right.
And if any problem like that, mentally or physically, this has to be taken care. Actually, we call in Ayurveda, this is the karma dosha, what you bring from your previous life. Okay, then what you attain.
Correct.
So who is punished? Parents.
Parents, exactly.
Especially when they see all these things, the parents are punished.
No, absolutely. I agree with you. Now, in the end, I just want to know what exactly would be the difference between perfectionist and a person with OCD, means obsessive compulsive disorder, because we have seen people, being very perfectionist. They want it exactly this way, that way, and what you describe about OCD, some of the symptoms to me, sounds like they are like perfectionists.
Yeah, that's a good question. You see, our industrialists.
Correct.
I don't want to use anybody's name.
Yes.
Tata Birla or anybody like that. You understand? Right. See, they all are perfectionists. Okay. They too have a compulsion to do the best for the mankind. Okay. So that is a perfection. Okay. They want to see how our country can progress. So they develop even like TV Asia, how they are doing. Okay. The same way it is. Okay.
Correct.
So they keep on doing something which will really make the mankind better. And they say giving opportunities for so many people. This obsession is entirely different. This is for destruction.
Oh, okay.
Okay.
I see.
Like somebody making some bombs and all. This itself is an OCD.
Correct.
Whatever you say, this. See, it is like programmed in their mind.
Correct.
You understand? So your buddhi is not working. Rest everything, like how these people, like the bombs are made, how they go and kill people, like Chaver we call it as, okay. So because it is all like a program, so they are made like a OCD.
Achha.
Okay, so okay, you go, we will take care of everything. So they push them for that.
Correct.
So that only one program is in their mind. So they don't see anything else.
Gotcha.
So this itself is an OCD.
Okay. In the end, I want to ask you a question. Obviously, if it's in a young age, perhaps it has a better chances to cure in a shorter time. But if person comes to you and a person is, let's say, mid-20s or mid-30s, what's the cure period for that kind of person?
Mid-20s and mid-30s, it is very easy because actually they themselves knows that they have the repetitive way of doing it.
Okay.
You understand? See, this is more important, like, because they will come and tell. I will ask them, you get the gargling sound, and they say, yes, doctor, you keep on doing. Yes, I do all those things. Yeah, I try to come out, but I cannot come out. Okay. So some people are very nice and they want to come out. Then the treatment is so excellent. Not only 30 or anything, even 40, 50s and all. Like going for urination like 25 times. Even there are people, I had some client who never wanted to drink water because if she passed urine means she has to take a whole bath.
Oh my God.
Okay. So the husband brought her to me by telling that because, see, the problem is like this. Then I asked her, she's telling that, I will, then I really, and her daughter is a medical student at that time, son is a medical student. And this very bad situation at home. Okay, very nicely. I could hold her in. I could hold her mind in me. I really treated her, and she's doing very well. Now she drinks water. I told, your kidney will be out. You want to transplant the kidney? She told, no. It took time because she was not willing to come for the therapy. I told, don't come. We will talk. I told her husband, just test me. Don't talk anything in front of the client. You understand? So it was an understanding with the husband. So he used to tell that how she's doing. She told she treats you like a god. It was, but she's perfectly all right. And I really thank because the situation at their home was so horrible. I tell you.
Okay. Yeah. So what you're saying is mid-age individuals are easy to cure in a shorter period of time.
Yeah, because of mid-40s and all, it's very. See, they know they want to come out. You understand? No. So, but these teens, it is very difficult. They don't accept it. So the parents have a tough time with them.
Okay.
Yeah.
Well, viewers, we are at the end of this Ayurveda Mantra show right here on TV Asia. And in this episode, we learned that obsessive compulsive disorder, meaning OCD, can be cured by Ayurveda, and that's what Santigram Kerala Ayurvedic Wellness Centers are all about. Dr. Nair, thank you so much for giving our information for our viewers on OCD, and it's really good to know that Ayurveda can cure this.
Ayurveda can cure it, it can manage, and it can really, even you don't have OCD also, if you all come for a, it's not a must that you should have an OCD. Any ailment, before getting, if you come, you can just see the pulse and see that what you should eat. And eating habits also, it is more important in this. They eat like either very hot, very cold, the diet is also very casual way of approaching it. Okay. Yeah.
Thank you so much. And viewers, if you have any question related to OCD or anything that you want to know about Ayurveda, please send us an email, info@tvasiausa.com, and let us know any question that you have. We will definitely cover it in this show. In next episode, we're going to talk about another disease, sickness, and ailment, and how it can be cured by Ayurveda. Thank you so much for watching Ayurveda Mantra. So long and take care.